No one really knows what's causing this crisis in mental health among young people. Was it the pandemic, all that social isolation? Is it the stress of modern life, endless choices, endless challenges? Is it all that social media? We do know the mental health crisis is real, and it can devastate families and whole communities. What state leaders are doing to try to help on today's Story of the Day.
Support for Story of the Day comes from Clarkson University, offering over 95 programs of study with campuses in the Hudson Valley, Central, and Northern New York. More at clarkson.edu.
Hey, I'm David Sommerstein. It's Friday, September 29th. First up, the mayor of Burlington will not seek re-election next spring. That's according to Vermont Public. Miro Weinberger has served 4 terms as Burlington's mayor. He was the first Democrat to lead Burlington in over 30 years when he beat out Republican Kurt Wright in 2012. While Weinberger has been in office, Burlington has seen a host of major development projects, including the renovation of City Hall Park and the construction of the Downtown Transit Center. The city also balanced its books and improved its credit rating. Weinberger says that's because of, quote, conservative budgeting and a prudent revenue increase. But Weinberger's tenure has not been free of criticism or scandal. A large redevelopment project of a downtown mall was bogged down by delays for nearly a decade. In recent years, the mayor was harshly criticized for several controversies to do with city policing and racial equity. Yesterday, the North Country had 2 representatives at the White House for a climate change summit. Those representatives weren't elected officials, though, or CEOs. They were 2 students who both serve on the Youth Climate Advisory Board of the Wild Center in Tupper Lake. They were some of the youngest attendees at the summit, but they've already had big impacts on their home communities. Amy Feiereisel reports.
I spoke with 21-year-old Andrew Fagerheim and 20-year-old Cedar Young before they headed to the White House. They were at their hotel in Washington, D.C., and they were all smiles and pent-up energy.
Definitely excited, a little nervous. Yeah.
The summit on building climate-resilient communities brought together about 70 people, including local, state, and tribal leaders, and these 2 young people, to talk about community-driven climate resilience strategies. Here's Andrew Fagerheim.
And we're really excited to be able to speak to some of the ways that we've seen that in upstate New York.
They got those invites through another summit, the Youth Climate Summit, which the Wild Center in Tupper Lake has been hosting since 2006. Each year, it brings hundreds of upstate students together to talk about climate change, justice, and activism. Fagerheim and Young both attended those summits as high schoolers. Young is from Saranac Lake.
This program is honestly the reason that I'm interested in climate work to begin with. Like, this is where I learned about the problem, and this is where I learned where I could be in the solution.
Fagerheim is a native of Homer, just south of Syracuse.
And I feel, for young people especially, this is something we're going to be dealing with for the rest of our lives. This is where I first learned about climate change, and also where I first felt like I could do something that made a difference.
After attending the Tupper Lake Summit, both Young and Fagerheim were instrumental in getting their hometowns certified as climate-smart communities. That's a state program that helps local governments take action to reduce their greenhouse gas emissions. As teenagers, they worked in their villages to get them certified. Young was a student representative on Saranac Lake's task force.
Getting to learn about how local government functions, and that really cemented my interest and passion in policy making and that sort of thing.
Because of that work, Young and Fagerheim were invited to attend the House Summit on Building Climate-Resilient Communities. They were accompanied on their trip by 30-year-old Hannah Barg, who works at the Wild Center.
I'm kind of being the climate mom for this group.
But Barg didn't go to the summit at the White House with them, and she thinks that's important.
Cedar and Andrew are the representatives who got invited to this event, and that I'm really just here as a support role. It makes me feel really honored to be with you today.
Before they headed off to the White House, I asked what they were most excited for.
I'm really looking forward to getting to meet so many people from around the country who are doing climate work on different levels. I haven't really had the chance before to do such a professional event and get to network with such professional people in all fields of, I guess, the world, because it's going to be scientists, tribal leaders, government officials,
I think like Cedar, I'm just really excited to meet the other people there and to learn from them. So to hear how other people are approaching this issue, engaging their communities, building resilience in their communities, I think is really exciting. And if we have something to offer to the group as well, I think that's great.
Fagerheim and Young were some of the youngest attendees at the summit. Amy Feiereisel, North Country Public Radio.
Many teenage New Yorkers are struggling more with their mental health, especially since the coronavirus pandemic. This week, public media stations statewide are focusing their reporting for Teen Mental Health Week. Karen DeWick takes a look at what the state government is doing to alleviate the crisis.
Governor Kathy Hochul and the legislature invested $1 billion into mental health services in the current state budget. Part of that money is earmarked for services specifically for teenagers. Health leaders, including the U.S. Surgeon General, say a recent spike in mental health challenges among young people has had a devastating effect.
Good morning to all of you. Thank you.
The governor spoke at a summit on youth mental health back in June. It followed a 3-month-long listening tour hosted by Hochul and led by a team of mental health experts, where over 200 youth spoke and shared their struggles. The governor blames COVID pandemic-related lockdowns and the influence of social media for the increase.
Teenagers are facing a crisis like never seen before in the history of this country. There was a time when it was always binge drinking, drunk driving, smoking were the greatest evils. Today it's so much deeper. It's anxiety, it's depression, and it's suicide. If you look at the statistics, they're absolutely staggering. And it's just a reminder that we're failing our children.
She says that according to the CDC, 42% of high school students feel persistently sad or hopeless, and 22% say they have considered suicide. The numbers are even higher among LGBTQ youth. This year's state budget includes $10 million in grants to suicide prevention programs targeting high-risk youths and a $20 million expansion of mental health services in schools by increasing Medicaid reimbursement rates for school-based mental health clinics. New York's Commissioner of Mental Health, Dr. Anne Marie Sullivan, says the goal is to have a mental health clinic in every school in the state. Speaking to public television's New York Now, she says 1,000 clinics exist now. Another 200 to 300 are in the works.
They can talk to a mental health professional. That youth can get some services right there in the school in a non-stigmatizing way. So that's a major initiative to have those services available.
She says there's also a 24-hour counseling and crisis line reached by calling or texting 988. Those who need more care are referred to a hospital, a clinic, or a therapist. She acknowledges, though, that there is a severe shortage of qualified therapists to meet the need. Sullivan says her agency is working with schools to encourage career paths in mental health treatment.
We've already been talking to some high schools to let us come in and speak with them, and colleges, community colleges. So I think we really need to talk with social workers when they graduate. What do you want to do? You know, there's different things you can do with a social worker, or nurses, or physicians, whether you want to become a psychiatrist. So it's engaging people.
She says the state also offers student loan repayments to doctors who want to specialize in psychiatry and to nurse practitioners who want to work in the mental health field. Sullivan says this year's budget also includes money for partial loan repayments for psychologists, social workers, and mental health counselors, as long as they agree to work in a public health clinic for a period of time. In Albany, I'm Karen DeWitt.
We have more news all the time and through the weekend on our website, ncpr.org. Music today by Evan Veenstra of Gananoque, Ontario, and Michael C. Hart of Malone. Have a great weekend. I'm David Sommerstein, North Country Public Radio.